Hello class. My sincerest apologies to those who may be thinking that I'm doing another recipe this week. But I hope this is enjoyable to you as it is to me, because not only do I get paid for what I do, but I love what I do. And that is being a CyberKnife therapist. What you're going to be learning today is the difference between conventional radiation therapy and CyberKnife stereotactic radiosurgery. Also, we'll be doing a demonstration, so for those who are unfamiliar with what CyberKnife may be, you're going to be able to see it also. Now, to start off with, what is conventional radiation therapy compared to CyberKnife therapy? CyberKnife therapy, with it being stereotactic, means we deliver high-dose radiation between 1 and 5 treatments. And with conventional, it can be anywhere from 180 centigrade a day, which is the measurement of radiation that they utilize, and 300 centigrade a day, up to between 10 to 40 to 40 plus treatments. Now, CyberKnife, the difference with the dose on a daily basis is we probably start at about 300 centigrade a day at the low point, which would average, low point for us is 700 centigrade a day, up to and above 2,000 centigrade a day. That's a lot of radiation for those who may not know. Now, how are we able to achieve such high doses in short fractionation or number of treatments? Is that we're able to do sub-millimeter accuracy. Now, we're able to obtain that by using a robot which is able to treat on a spherical type motion, which in conventional therapy, if you think of your tumor being here, and the middle of your beam for the rotation for the machine being in the center of the tumor, it can travel 180 degrees in each direction, being on one plane. Now with CyberKnife, this is your tumor, but you are not held to just being treated to the center of the tumor. With it having a spherical, or think of a globe and points along that globe with thousands of options in order to treat from, you're able to come at different angles and paint your beam onto that tumor using high-dose radiation. Now, what's the advantage of that? Well, think of your spinal cord. Now, if you were treating with conventional and only had it 180 degrees in each direction, you have to limit the dose to your spinal cord. But now you have the CyberKnife and you're able to paint the dose around that spinal cord. Now you are limitless what you can do, because the only thing that should be getting the radiation is the tumor and not the spinal cord, because of that sub-millimeter accuracy. How do we know that we're maintaining sub-millimeter accuracy? We have X-ray machines that are mounted on the walls. You'll see those shortly. I will point those out to you. That take what's called interfractional X-rays. That means during the duration of the treatment for these patients, it's taking X-rays. Now, those treatments can last anywhere from 30 minutes up to about an hour and a half. I would say our average treatment for a patient is 1 hour. Now, there are cases where it can last a lot longer than that. And compared to conventional side, the advantage they have over us is their treatments are anywhere from 10 to 15 minutes, Monday through Friday, up to 8 weeks. So there's a difference, in my opinion, that 1 hour a day for up to 5 days is a lot better than 15 minutes for 8 weeks. Now, we're going to show you what this demonstration is. This is going to be a brain patient. Now, we do a lot of brain patients with which is metastatic from somewhere else in the body. Now, how that differs from conventional side is that they focus on the entirety of the brain, where we treat just a small portion of the brain, where it's not going to have any impact on the surrounding tissue. Also, with non-cancerous tumors within the brain, we treat AVM, which is arteriovenous malformations, as well as things along the optic chiasm and the optic nerve, which, if it's pushing on that, can cause blindness, and we can help alleviate that. But what I'm going to show you today is the brain. And with this is you have what's called a DRR, which is digitally reproduced radiograph from the CAT scan that we took on their simulation day, or their first planning day. This is the live image from the X-rays that we are taking from the patient, and there's the overlay. Now, the difference between this one and this one from the patient is what your corrections are. The machine will make those corrections throughout the duration of the treatment. That would be from front to back, left to right, and from head to toe, as well as what's called yaw, pitch, and roll. Yaw is the difference between head to foot, as well as pitch is head to toe, and roll, which means the patient rolling from left to right. Now that's 6 different degrees of variation that we can account for throughout the duration of the treatment. So you see these numbers. These are going to be small because this is an artificial patient, which is a phantom. And we're going to hit the start button, and we're going to start by going in the room and continuing this whole process from in the room. Okay? So just follow me and we'll go inside. So here's our phantom that I was talking about. And for the sake of this demonstration, we're going to call him Frank. That's not his name, but it's good as any. Now on the ceilings you can see are the X-ray generators. The floor are the panels that captures those X-rays, and they're coming across ways throughout the patient. Now we use a laser, as you probably see the red light. That just helps us to align so we know where the patient is at. Now for this demonstration we have what's called a fixed cone for this patient. Now that's what's on this table here. As you see these little silver cones, they are fixed sizes from 0.5 or 5 millimeters, I'm sorry, all the way up to 60 millimeters or 6 cms. Now they're very accurate and those are precise, but for patients that require multiple sizes throughout the treatment, which in order to cut back on the treatment length itself, we have what's called an iris. Now what that iris does is, if you think about it, it opens and closes on a twisting motion to the size that you need, to about 0.1 variance. For brain patients who are treating along the optic chiasm or the optic nerve, or any structure within the body that's very, very critical, we will use the fixed cones. But the iris we generally use for other areas, liver, lung, pancreas, prostate, and a multitude of bone mets. Now, this demo, and I'm going to start it right now. There will be no radiation that you're going to be receiving during this. Of course, this is just a demonstration. Now, there's going to be a laser that comes on, and that's going to, what that's going to do is it's going to say that this is the beam and this is where it's at when it's being treated. Now, it looks like it can be scary at patients at times, and we do tell them that it does come close and it does make some noise, but it will never hit them. We have cameras throughout the entirety of the room that keep an eye on the patient, as well as there's a built-in safety program that allows the machine to know where it's at and why it's there. And if it gets too close, it'll stop automatically, but you don't want to take human error out of the equation too. You want to make sure that you're watching it also, in case for some reason the machine may misinterpret where it's at. Now, when we first started this, you did not get to see it, but the machine will check itself every time you turn the beam on to see where it's at in location to where the table with all those cones are at. That way, everything that's in the room is already pre-programmed. The X-ray generators, the table, different varying heights of the machine, as well as the size of the patient. Now, this is very interesting here because, like I said, this is a robot. It has 6 different degrees of rotation on it, and it comes from all around the patient. The tan area on the floor is the actual area that the machine is going to be capable of traveling into. So whenever we do demos, we try to tell people to stay outside of the tan, but I've done this enough times so I know exactly where this machine is going to be at any given point. So for a brain patient, what we would do, they would not normally be laying there, because what would happen is that just any slight motion within their chin, whether up, down, left, or right, is going to change how the machine is going to react to it. So we have what's called a mask that we put on these patients. Without showing you a patient's name, we have these plastic, thermoplastic Aquaplast masks that they come out as, they are a solid piece of plastic. We heat them up in a hot dog bath, if you want to call it, and we form it over the patient. And as it cools, it hardens, and this patient is able to maintain this position throughout the entirety of their treatment with very minimal motion. Now that differs from some areas of stereotactic radiosurgery by not having to screw something into their head, but maintaining that sub-millimeter accuracy. Now, if we were treating a lung patient or something that actually would move, we would have 3 LED lights that would lay across their belly. What that does is that it captures the breathing motion of the patient. And we use this sensor bar here pick that up. Unlike conventional radiation therapy, what it does is just during a certain phase of the breathing, it'll beam on, only at a certain point, because it knows it's going to capture that. What we have with the advantage with that LEDs is as it's moving, the machine's picking that up, and it can turn the beam on at any time during that patient's treatment, and it will always follow it. Because unfortunately, tumors don't just travel in one plane, they can travel in 3 different. So if it's moving like this, the machine is also doing the same. And like I said, that is an advantage when you're treating something that moves, especially a lung tumor that sits on the diaphragm. If anybody knows, if they've seen anything like that, is that it can move up to about 2 centimeters in either direction. So if you're not using anything with this LED type technology, then you're going to actually lose out on a very effective treatment. Now this patient alone, for brain patients, we look at about a half an hour from the time they walk in the room to the time they walk out. And now that's all going to be dependent upon also whether or not the patient is compliant. If the patient's not compliant, then it's going to actually take a little longer. And with lung patients and liver patients, they take anywhere from about an hour. Now prostate patients tend to be the ones that take the longest because there's a lot of things that can happen with the prostate patient. Your prostate, the way it sits inside of a gentleman, is that it has a bladder that sits on the front and the rectum that sits on the back side. If the bladder fills, it can push the prostate posterior towards the patient's back a little bit. If there's gas or any other material that comes into the rectum, it can push it anterior or towards the front. Well, that can definitely change the position of the patient. So we want to try and make sure that those are empty during the treatment so it doesn't change that at all. Now, once again, like I said, with this machine, it's going to travel the entirety all the way around this patient. And this patient, when they're done, is not going to know any difference between, when they came in the room to the time they left. They're not going to notice any side effects. The only side effects that they may have may be a little bit of fatigue and maybe some steroidal use that they may have to use, but that can be tapered off and not be used at a later date, or discontinued at a later date. Conventional side, you have hair loss, you have headaches, there's a multitude of issues with the brain case alone, not speaking of the side effects that can happen with the lung, with the liver, and so forth like that. You're going to have redness of skin, irritation, itching, dryness, and possibility of cancer that can arise later on in life. With the CyberKnife, you have really no side effects. There's no hair loss. There's no redness of the skin. The only thing that you may feel is maybe like a little tenderness in the area that was treated. Because you have to understand, with such a high dose of radiation, that is, the only side effects that you can come across. Now, in regards to conventional side, with delivering radiation, unfortunately, later on in life, if individuals live long enough, there may be an occasion for them to develop a secondary cancer from the radiation usage. Or they may recur within the same area that they had cancer. With the CyberKnife, with that sub-millimeter accuracy, we're able to retreat those areas or treat those areas anew. And because of that, we have a lot of patients that are coming back if they need to in order to have the CyberKnife. That is unfortunately a disadvantage anytime that you have a reoccurring cancer, but optimism is that with the CyberKnife you're able to get the retreatment. Lung patients, it's great for lung patients, especially in the very early diagnosis, early stage cancer. With late stage, if patients can't have surgery, this is a great option because what happens is they don't have to go through pulmonary rehab, or if they're not a candidate for surgery in the first place, with lung cancers, this is perfect. We're able to put them on oxygen or even on high levels of oxygen so they're able to maintain their breathing functions during and after the treatment. Now, I hope that this was informative. I hope you learned a little bit of difference between what is conventional and what is stereotactic radiosurgery. This, in my opinion, is the way of the future. Conventional, although it still has its place, is becoming a more obsolete treatment compared to this technology. I hope everybody has a great day, and I hope you learned a lot. Take care, and we'll see you next time.